Hello, family. Today, let's talk about the role of ultrasound in managing uterine fibroids. What are uterine fibroids? These are non-cancerous growths which are found in the uterus, and one of the medical tools that is available for us to diagnose these is through an ultrasound. And today, I know I've been talking about the role of ultrasound in diagnosing fibroids, but today I just want to look at the role of ultrasound in managing these fibroids. How does ultrasound come in when we are managing these uterine fibroids? One, when you're doing ultrasound, you want to look at the size of the fibroids. And how is the size important when you are managing fibroids? Small fibroids, sometimes the doctors will just want to look at them and observe them and watch them, even to follow them up, to make sure that they're not growing rapidly even before they choose which method to treat them. The second thing, when you're looking at the size of the fibroids, if they're big, if the doctors are going to choose a surgical procedure to remove these fibroids, there are different surgical procedures that have been employed outside there in removing fibroids, and it depends on the sizes. Some of them could be laparotomy, laparoscopy, keyhole, laparoscopy, and all these procedures are good for specific sizes of uterine fibroids. The next thing is, when you're doing an ultrasound, you want to look at the location of the fibroids. Are they at the anterior part of the uterus? Are they at the posterior part of the uterus? Are they at the uterine fundus, or are they in the uterine cavity, or are they just around the are they on the uterus wall? So again, if they're employing surgical procedure to remove these fibroids, the location of the fibroids is very vital, because some of these surgical procedures are good to remove fibroids in different location, which are found in the different location around the uterus. Again, we want to look at the components of the uterus. Are they calcified? If they're calcified, again, the method that are going to be used for treatment are different, because sometimes when they're calcified, it might just mean that these fibroids are not growing further. Or if they're calcified, again, if they're choosing a specific surgical method to remove them, again, they will want to know, because if they're calcified, different methods of surgery are going to be employed in removing them. We also want to look at the vascularity. If we can choose the perfusion of these fibroids, if we can pick the vascularity or in these fibroids on ultrasound, again, if the medical team are going to use uterine artery embolization to remove these fibroids, again, is going to be helpful if we can speak to them, or if we can detect vascularity in these fibroids. So again, I've always said God has given us this technology, so at least to improve our life, to improve management of some of these diseases. So once you go to the hospital and you are told to do as an ultrasound scan, kindly go and do it, because an ultrasound plays a vital role in helping us even to manage these fibroids better. And God has given us this technology so that at least our life can be improved. So once you're given this, once you have been told to go and do this examination, kindly go. And those who are doing the scans in the medical imaging fraternity, these are some of the things that at least we are supposed to talk to. You are supposed to communicate to the medical team handling the patient. We need to look at the site, we need to look at the vascularity, we need to look at the location, we need to look at the component in the fibroids. At least if we can give this to the medical team, we are going to help them manage these uterine fibroids better. So again, I've always said, don't fear doing this procedure. They are simple procedures, they are easy procedures. The doctors or the physicians who are asking these procedures, once you get the report, at least I know these are some of the information that at least you are supposed to get. You are eager to know and to get from the ultrasound report that is being given to you. So again, it's always good to speak to you. I've always said just speaking to you and just engaging with you, it has always been beautiful. It's always been good. I always feel better when I share this information, because I know information, once we get the information shared, it always helps improve people's life in our society. And I've always want to engage you. If you have any comment, just drop it. I'll be willing to answer it. I'll be willing to engage with you even on this platform. So thank you very much. It's always good to speak to you, and I'm always just looking forward to speak to you next time, even as I bring my next topic. Thank you. Have a great day ahead.